Hi everyone, this is Professor Widener. Welcome to week 2 of research. This week we're going to talk about the PICO-T development and ethical considerations for evidence-based practice. Chapter 2 is going to talk about PICO-T development and asking compelling clinical questions. The first thing we need to do is be curious about what is the right thing to do, and that starts with the clinical inquiry. Without reading the definition to you, basically what you're going to do is have a topic that you're curious about, and then you're going to look up information to decide what is the best choice of treatments. And remember, you're going to hear a lot about, like, when you're reading, you'll hear a lot about like asking the burning question. I would say it's something that you're curious about. Remember, a lot of you were kind of curious in your discussion board this week. We're saying like, well, I'm not really sure. I'm worried I won't pick the right thing. Remember, we're going to work on these PICO-T questions over the next 2 weeks to help you kind of narrow them down and get them into good shape. And as I was told working on my doctorate, this isn't your life's work. This is basically to learn the process. And the most important thing you can do right now is learn the process for how to complete these clinical inquiries with evidence-based practice. So the slide talks a little bit about organizational culture, and some of you noted that during your discussions this past week as well. Organizational culture is important to support evidence-based practice and make it sustainable, but sometimes it is very difficult to have people change the way kind of we've always done things. And the interesting thing about nursing is that it started out that we didn't have a lot of research to back up what we did. We kind of knew they were the right things, but we didn't have a lot of evidence to show that. But as nursing has progressed in its profession, it's now become more standard to have evidence backing up our interventions. And that's kind of what has moved us from basically forward with our profession and overall respect. So when we're looking for the right information, basically we have to do a literature search about that information and then formulate the question into something that's searchable and answerable, which is the PICO-T format. So what are some of the barriers to finding the right information at the right time? And these things are things you're probably all thinking about right now. There's a proficiency in using computers or a proficiency in computer access at point of care. And we all know the hospital that doesn't allow their providers or their nurses to look something up online, but that's just kind of not very forward thinking, especially now with all the evidence and information we have available to us. There is a low comfort level or lack of skill using search techniques, a lack of access to appropriate electronic databases, and lack of time to search for the best evidence. And those last 3 are going to be answered in the library section. Laura Rock is going to provide some information instruct you on how to use Misericordia's resources so you can find the best evidence that is available. There are 2 types of questions that clinicians might ask. The first type is a background question, and it usually asks for general information about a clinical issue. It usually has 2 components, the starting place of a question and the outcome of interest. It has a much broader scope than the PICO-T. It's just a lot more general. For example, how does amphetamine lower fevers? But then when we look at foreground questions or PICO-T format questions, these ask for specific scientific evidence about diagnosing, treating, and educating patients. They focus on a specific knowledge. And you also create a question with this format that is focused, efficient, and effective to guide your literature search. So the example based on the amphetamine question is, in children, how does amphetamine compared to ibuprofen affect fever management? So again, don't overcomplicate your questions. Just take it to, these are about taking the next level. Some of the questions that you might, so foreground questions, for instance, PICO-T questions, these are some of the things that further break these down. You may have an intervention question that asks what interventions most effectively lead to an outcome. You may ask a prognosis or prediction question about indicators that are most predictive of an outcome. You may ask a diagnosis question as to what tests most accurately diagnoses an outcome. You could ask an etiology question, again, how does someone get something, or what is most highly associated with an undesirable outcome? Or you could ask a meaning question that asks how experience influences either an outcome or the scope of a phenomenon, or the influence of culture on behavior in healthcare. So there's lots of different ways you could focus your question to add to taking care of your patients. So question number one, actually, is this true or false? A well-formulated PICO-T question should specify the measurable patient outcomes that need to be addressed. And that is true. A PICO-T question always has very specific outcomes that is expected from the clinical question. That is how you're going to evaluate the effectiveness. And if you are, just to further clarify, if you're in the MSN program, you will come up with a PICO-T question and you'll do the research on it and then formulate an answer based on the literature that you found. And if you are in the DMP program, you'll also format a PICO-T question. You will do a literature search and come up with a plan, and you will actually implement your intervention and then evaluate the effectiveness of that change. So the burning question at the moment is, how do we formulate a PICO-T question? Well, first of all, let's talk about what PICO-T actually stands for. And P is the population of interest. I is the intervention or the issue of interest. C is the comparison of interest. O is the outcome expected. And T is the time needed for the intervention to achieve the outcome, or the time in the course of the disease or symptom that the intervention is applied. Please note that the purpose of the PICO-T is to guide the systematic search of databases. Time is an option, as it can limit your search. There are different templates for forming these PICO-T questions. So this is what you're going to, this week in our discussion board, where you're going to look at forming your PICO-T questions, and then we're going to give each other feedback over the next 2 weeks. Go right back to these templates to help you put it together. So this is an intervention template. So the example would be, in adolescence, how does oral contraception compared to long-acting reversible contraception affect birth rates within 1 year of onset of sexual activity? So you'll see that's a very formulated question. It answers all the PICO-T initiatives, and it has a specific time frame. When you're looking at a prognosis template, you again, it will read through the example. In firemen is the population. How does protective gear plus a showering protocol post-response to a fire, which is the intervention, compared to protective gear alone, influence or predict diagnosis of cancer over 5 years? So again, the intervention is a showering protocol as compared to just wearing their protective gear. How does that influence the prognosis of cancer? If you're looking for a diagnosis template, you're going to look at it like this, and I think these examples keep it kind of simple and make it understandable. But in patients with hip joint trauma, who's the population, is CT scan, the intervention, compared to the MRI, more accurate in diagnosing a hip fracture? So again, you will be able to find information on that. For an etiology template, you're going to use this format. Are women diagnosed with breast cancer who have an oncotype diagnosis score greater than 18 compared to those without an oncotype diagnosis score greater than 18 at less risk for reoccurrence of breast cancer the first 5 years post-diagnosis? So you'll see how very specific it is. And if you use the meaning template, you're going to look at how do oncology patients with feeding tubes perceive nutritional intake during chemotherapy. So again, when you're formulating your own questions, kind of think of where it's leading you and then use those templates to guide your question formation. Question number 3, which of the following components of a PICO-T question is absent from the following clinical question? Among patients with dementia, how does the use of reorientation therapy compared with regular supervised mobility affect patient agitation? So are we missing population, intervention, comparison, outcome, or time? And you'll notice time is the missing component, as it does not provide an expected time frame for the expected outcome. So look at these templates and think about what you're interested in. If you look on our weekly resources, there is a video on PICO-T formation that is actually very good, that explains it in another way. So listen to those, and if you have any questions, remember I'll be in regular office hours, or email me. I'll be happy to set up a time to help or talk you. Take care.